If you are considering dental implants, teeth in a day, all on 4, or similar procedures, then there are 10 important things you need to know when selecting a dentist to be your dental implant provider. Specialized training and certification matters. It is wise to use a dental specialist who has gone through years of additional education and training after dental school to develop significant expertise in their area of focus. The American Dental Association officially recognizes 9 specialties, and 3 of them are highly qualified for dental implants and related procedures. Oral and maxillofacial surgeons, periodontists, and prosthodontists. If you are considering dental implants, teeth in a day, all on 4, or similar procedures, then it is recommended you consult with one of these specialist types. As in any occupation, the more experience you have, the better you tend to become. The same is true of advanced dentistry, such as placing dental implants. Specialists who have placed a high number of implants have more experience detecting potential problems and properly planning the treatment accordingly. This can help prevent implant failures and other complications that may arise during surgery. Ideally, your dental implant provider has placed hundreds of dental implants and does them on a regular basis. It is best to work with a practice that will spend time to thoroughly understand and diagnose your actual treatment needs. Some dental groups focus on a limited number of procedures in order to become very efficient and make more money. However, it is not necessarily in the patient's best interest. Ask your dental implant specialist why they are making the treatment recommendation and if there are other treatment options you should consider. If you have received a quote and are not totally confident in the recommendation, then you might consider seeing an implant specialist listed on this website to get a second opinion. The gold standard for treatment planning and diagnosis of implant-related procedures is with the use of 3D cone beam technology. During dental imaging, the cone beam scanner rotates around the patient's head, obtaining hundreds of distinct images. This gives the dental implant specialist a very detailed understanding of the jaw, bone structure, roots, and related information that are critical for proper placement of dental implants. This technology is vastly superior to 2D imaging techniques such as X-rays or panoramic film. Implant specialists who use premium dental implant systems such as Noble Biocare, Straumann, or Astratech are making an investment in your long-term health. These major manufacturers have decades of experience and have invested large sums of money into R&D, research and development, and state-of-the-art manufacturing of dental implants and related components. Mini implants are smaller than traditional dental implants with a diameter of less than 3 millimeters, whereas traditional dental implants normally measure 4 to 5 millimeters in diameter. Some dentists use mini implants instead of traditional dental implants because they are much cheaper. However, there are potential risks with this approach. Traditional-sized dental implants have been used for decades and have large amounts of clinical data to clearly demonstrate their track record and predictive results. Many traditional dental implants will last 20 to 30 years or more. Mini implants have not been used until fairly recently, so there's not nearly as much evidence and data to know if they will be as effective as traditional implants. Many specialists today are hesitant to use mini implants in their procedures as a long-term solution. You get what you pay for. This saying has been around forever, and it's particularly true with dental implants. There are many ways to cut costs and quality that a patient might never know about. For example, high-quality dental implants are more expensive than inferior quality implants. Proper sterilization takes time and costs money. Highly trained dental implant staff typically cost more than lesser trained staff. Mini implants are cheaper than traditional dental implants. Using 3D cone beam scanning technology costs more than 2D X-ray scans. And the list goes on. If you receive dental implants and something goes wrong with your procedure, or if there is a failure within a few years after the surgery, then it is very likely you will be referred to an implant specialist, such as an oral surgeon or periodontist, to fix the problem. In this case, the patient has little to no financial or legal recourse with the dentist who performed the procedure. Even worse, dental implant failures often lead to more expensive procedures to fix the issues created by the failed implant. It is a wiser approach to make sure your dental implant procedure is performed by a highly trained dentist from the beginning to minimize the risk of a failed dental implant and the corresponding problems they create. To prevent infections and health complications, it is very important to follow a proper sterilization process to ensure clean implants and tools are used. Proper sterilization takes time and costs money. So avoid any dentist that does not take the time to properly sterilize before procedures. Implant cases can be done with local, oral sedation, moderate IV sedation, or general anesthesia. Ask your dental implant specialist about the options they provide and what they recommend. You should have the freedom to discuss the options and mutually agree upon your sedation choice.